About several months ago, I decided to take a course on vegetarian diets at Cornell University in my senior year. I always joked around with my friends saying that I was a hardcore carnivore and that nothing could ever stop me from eating meat. I remember I would feel bad for vegans or vegetarians because I thought that they weren't enjoying the luxuries of tasting delicious meat every day. I grew up within a household with grandparents that always told me that eating a lot of red meat was great for getting taller and maintaining a healthy body. And taking this information from my grandparents, I always believed that this was indeed the scientific truth. Of course, as I grew up, I came to a realization that red meat was associated with cardiovascular disease, and I became more aware of the negative health consequences from eating too much. However, I was never moved by this information. I simply was, ignorant. Initially, when I was in the middle of contemplating whether I should sign up for this vegetarian diet class at Cornell, I was worried that it would be a boring class about a specific vegetarian diet plan that I had no interest in whatsoever. However, aside from the fact that it fulfilled my graduation major requirements, I decided to give it a try because I also wanted to educate myself and understand why people out there really stuck to vegetarian diets aside from religious reasons. Specifically, I was interested in the effects of vegetarian diets on my overall health, disease, and mortality. And long story short, after listening to many lectures, I came to a solid conclusion. The vegetarian diets reduce the overall risk of cardiovascular disease mortality, as it stays away from heavy red meat consumption and instead resorts to healthy plant-based foods that have fiber and more healthy polyunsaturated fatty acids. This wasn't just some random epiphany. This was all backed up by critically analyzing many scientific papers and studies that were conducted in the past to help show evidence that this is indeed the truth, that vegetarian diets are associated with reduced mortality from cardiovascular disease. Today, I will be talking specifically about the effect of plant-based diets and its association with a lower risk of cardiovascular morbidity and mortality in a general population. First of all, I want to talk about vegetarianism and its relation to blood cholesterol. The total and LDL cholesterol was about 20% lower in vegans than meat eaters, which could be explained by differences in saturated and polyunsaturated fat intakes. Observational studies suggested that vegetarian diets were associated with a mean concentration of total cholesterol that was lower by 29.2 milligrams per deciliter. Another study showed that 1 millimolar per liter lower total cholesterol was associated with around 30% lower cardiovascular disease mortality, as well within the age range of 60 to 69. In other words, the higher the cholesterol in one's blood, the higher the risk from dying from cardiovascular disease. The one role that red meat plays is that it raises cholesterol levels in the body. And so a plant-based diet has the potential to not only lower your serum cholesterol, but also reduce your risk of dying from cardiovascular disease as a result. Not only do vegetarian diets lead to lower blood cholesterol, but vegetarian diets full of potassium, calcium, and fiber have shown to decrease blood pressure as well. For example, a study involving a DASH or combination diet rich in fruits, vegetables, low-fat dairy foods with reduced saturated and total fat can substantially lower blood pressure. This diet offers an additional nutritional approach to preventing and treating hypertension. As a result, vegetarians had 5 millimeters of mercury lower blood pressure than omnivores, which was associated with a 12.5% reduction in mortality from cardiovascular disease, as shown in a meta-analysis of 1 million adults in 61 prospective studies. And so again, a plant-based diet has the potential to not only lower your serum cholesterol, but also your blood pressure, thereby reducing your risk of dying from cardiovascular disease. And all these facts that I've just stated are backed up by research papers and meta-analysis that have thoroughly been investigated. The association between vegetarian diet and serum cholesterol, blood pressure, and its effect on lowering cardiovascular disease mortality risk. I sincerely hope that these findings influence heavy meat eaters out there to reconsider the effect that meat is having on their own health. And like I said, I was a heavy meat eater in the past, but after taking this vegetarian's diet class, I am now very convinced about the positive effects of adopting vegetarian diets in my daily life. I've already convinced people around me, as well as my family members, to adopt the benefits of heavy vegetable consumption. My family and I used to be heavy meat eaters, so to be honest, it's difficult to completely take out meats from our diet. And I'm pretty sure there are plenty of people out there who definitely can't imagine eliminating meat from their diet as well. However, in terms of ratio and frequency, my family and I do eat more vegetables compared to meat and are working hard to avoid mortality from cardiovascular disease. And so with this information, I strongly encourage everybody, and specifically heavy meat eaters out there, to become more aware about the health consequences resulting from their dietary choices. It's not an easy transition, but daily changes to your diet by focusing on eating more plant-based foods is the first step to being healthy and to preventing cardiovascular disease. Thank you for listening.